Hypersensitivity reactions means the exaggerated immune response to an antigen that is usually not harmful to the body. And there are 4 different kinds of hypersensitivity depending on how the immune system reacts to that non-harmful antigen. So we'll take a look at the 4 different kinds. Type 1 or the immediate reaction hypersensitivity, and that is kind of like your default allergy. So when somebody says that I'm, say, allergic to peanuts or so on, they're talking about this type 1 immediate reaction hypersensitivity. And it's an immediate response to the exposure to that allergen. So an allergen is anything that can generate or cause an allergic response. These allergies are the allergic reactions that occur to the person are due to the IgE antibodies, where they are produced against specific allergens. So whatever that person is allergic to, they would have lots of IgE antibodies against it. And when they are exposed to that allergen, that will lead to the release of lots and lots of histamine. And that's why if somebody gets an allergic reaction, they give them an antihistamine. Some of the symptoms can include, for example, hives, hay fever, an asthmatic attack, and it could go all the way to an anaphylactic shock, which is the swelling of the throat, which is a life-threatening form of allergy. Now, the type 2 hypersensitivity, also known as the antibody-dependent cytotoxic reaction, this is where there is an antigen and an antibody that combine together, and that is going to lead to the activation of complement, and complement is going to destroy that antigen. So I'll give you an example, which is transfusion reaction. So somebody gets the incorrect blood transfused into them, the antigen and the antibodies are going to identify each other, and that will lead to the agglutination reaction. Okay, that will activate the complement and now in the recipient's body, leading to lysis of those red blood cells that the recipient just received. The type 3 hypersensitivity is known as an immune complex reaction, and here again the immune system lost that ability to identify self-antigens and produced antibodies against their own antigen. So you see here there's a complex, the antigen-antibody complex, that is going to be deposited in different cells and different tissue, leading to their destruction, again, through the complement activation system. So for example, rheumatoid arthritis, and I'll use that example that's in your textbook. Rheumatoid arthritis is an autoimmune disease where the person makes antibodies against their own joint tissue and other connective tissue. So the antibody will attach to the antigen, making that antigen-antibody complex. It will deposit into the joints and other connective tissue, leading to the destruction of joints. Okay, so you can see here that the destruction, again, occurs by the antigen-antibody complex that is deposited in these tissue. Type 4 hypersensitivity is also known as delayed reaction, and that is where somebody is allergic to something, but they do not react to it on the first exposure. They react to it later on, maybe 2 or 3 days later. So if you work in the field of healthcare, you might have gotten a TB test done where they do a very small subcutaneous or intradermal underneath the skin of an injection of TB. And they ask you to come in 2 days later to see if your body responded to that or not. So that is because that reaction doesn't happen until about 48 hours later. So it's a delayed reaction. It is mediated through T lymphocytes, okay, where the T lymphocytes are going to release different chemicals leading to the inflammatory process. So again, when you come in after being injected with that TB, which is obviously not the active kind of TB, it is definitely not going to cause any kind of tuberculous disease. but it can produce a local inflammation. So we look for redness, swelling, and heat in the site of the injection. If you take a bigger look at all of these hypersensitivity reactions, you will find that the first three kinds are mediated through antibodies, while the fourth kind is mediated through T lymphocytes. Okay, the type 1 is through IgE antibodies. Type 2 and 3 are through different kinds of antibodies. Again, type 4, that is through your T lymphocytes. Now, transplantation and tissue rejection, that is also another form clinically related to the immune system. So different kinds of organs can be transplanted. So for example, cornea, kidneys, bone marrow, lungs, pancreatic tissue. There's so many different tissues, and the list, is getting bigger. If the donor tissue is recognized as foreign by the recipient, that will lead again to the production of antibodies, and that can lead to tissue rejection reaction, where the recipient's immune system will destroy that foreign tissue. It really resembles the cellular immune response against pathogens, okay? Because again, it is a foreign body. Your immune system isn't that smart. Will detect that, this is a safe antigen. It's just a foreign antigen to the body that can elicit an immune response. And that's why immunosuppressive drugs are given to the recipient prior to transplants in order to decrease the risk of rejection. And it's also important to match the MHC antigens between the donor and the recipient. Obviously, the greater the match, the less risk of rejection. And on the other hand, the greater the antigenic difference between the recipient and donor, that means that can puts the recipient at risk of a stronger and a faster rejection. So again, to prevent that from happening, you want to find the best match in regards to MHC antigens and put the patient on immunosuppressive drugs. So these are the different kinds of transplants. There's an isograft, which is between identical twins. For example, bone marrow transplant, if one twin gets leukemia, the healthy twin can donate bone marrow to them, and it's a very safe transplant kind. Autograft, where you are donating tissue to yourself. So let's say a patient comes in and they have this huge scar because of a previous burn. Well, we can take a part of the skin from another part of the body and remove that scar, put that skin on, to replace the scar, and then the donor part or the part of the skin where you actually took that donation from will regenerate and produce healthy skin. Okay. That autograft, where skin graft from one part of the body to replace burned skin, as an example, that is a safe transplant because there are no new antigens that you're exposing yourself to. Actually, both of these, isograft and autograft, so either self-donation or donating to an identical twin, both of these do not cause rejection reactions. What do cause rejection reactions are these allograft and xenograft. So let's see what they are. Allograft means donations in between species. So if I cannot donate to myself, or if I don't have an identical twin, I'm going to get from somebody else that is still a human. Okay, so kidney transplants from a relative or a closely matched donor of the same species. So I'm getting again from another human. I am going to try to find the closest match, but it is not 100% identical. So there is still that risk of developing a rejection reaction. Xenograft is where we get transplants from different species. For example, heart valve replacements. These come from pigs. So that is a totally different species, and obviously that can also lead to a rejection reaction. Now, autoimmunity, we've talked about it several times. That's where the immune system will make antibodies against its own tissue. it loses the ability to differentiate between self and non-self, and it makes what are known as autoantibodies. These autoantibodies can attack different kinds of cells depending on the antibodies that are being made. And unfortunately, we do not know the exact cause of autoimmune diseases. We do know risk factors, for example. So gender, we find that autoimmune diseases are more common in females. Is it because of having a family history? Does it run in families? Is it kind of invoked by a viral infection? Sometimes they are induced by different medications. So there is really no known cause to autoimmune diseases. There are several theories, but we still do not know an actual cause of it. These are different autoimmune disorders. There's several of them that have been mentioned throughout the course, and you'll find that they are, hopefully you find them that, you recognize these. So we've talked about Graves' disease, which is an autoimmune disease in the thyroid tissue, where thyroid gland antigens, we made antibodies against these TSH hormone receptors, leading to hyperactivity and overstimulation of the thyroid tissue. Type 1 diabetes, making antibodies against the pancreatic beta cells. Hemolytic anemia, where we made antibodies against RBCs. MS, and that in these patients, making antibodies against the myelin sheath. MG, or myasthenia gravis, where antibodies are being made against the receptors for acetylcholine on the skeletal muscle. Pernicious anemia, making antibodies against the cells that produce intrinsic factors. Intrinsic factor that, again, was important to absorb vitamin B. Rheumatic fever, this is where the body produces antibodies against the streptococcal bacterial antigen. So these are usually kids that come in with a strep throat. The strep antigens look very close to the antigens of our heart valves. So the kid that had rheumatic fever that did not take an antibiotic for it, that kid's body produced antibodies against the streptococcal bacteria. Now these antibodies, not only are they going to attack the strep bacteria, they might also attack the heart valves. And that is why if anybody has a strep throat, it is extremely important for them to take antibiotics to prevent the rheumatic fever from happening. Rheumatoid arthritis, making antibodies against the synovial membrane, the cells lining the joints. Lupus, or SLE, that stands for systemic lupus erythematosus, that is antibodies against connective tissue. So you will find that in systemic lupus, it doesn't really affect just one part of the body because connective tissue is found everywhere in the body. So you'll find that they might have kidney disease. Lupus patients might develop facial changes because of the redness that happens. It could affect the brain, leading to encephalitis. So connective tissue is widespread throughout the body, and hence the name systemic lupus, because it could be anywhere in the body. Joints obviously included too. Ulcerative colitis, these are autoantibodies against colon cells. And I kind of skipped this one right here, glomerulonephritis, where you make antibodies against those streptococcal bacterial antigens. So again, a kid that comes in with strep infection, did not take antibiotic for it. The kid's body reacted to that strep infection by making antibodies against strep, which is good, but it can attack the kidney cells, okay, leading to what is known as glomerulonephritis. And that is, again, why it is very important to identify strep throat when it happens, to give antibiotics, not only to make sure that the kid gets well fast, which is a good thing, but to prevent, more importantly, to prevent this glomerulonephritis or rheumatic fever from happening as a complication of strep throat. Now, the immunity breakdown, which is the HIV infection / AIDS. HIV infection means that the person is infected with the human immunodeficiency virus without having clinical signs or symptoms, while AIDS means that they have progressed into that syndrome where now the immune system has been affected. Okay, the HIV virus is going to attack the helper T cell. Okay, remember the helper T cell is the one that activates your B lymphocytes and the cytotoxic T cells. So if the helper T cell is damaged, well, we kind of lost the activation of the rest of the cells. It also attacks macrophages, and that was one of the antigen presenting cells. And you could see how that would affect the immune system as a whole. Hey, the causes of death are usually due to the loss of the immune response against different pathogens and different cancers. So our immune system not only protects us against infections, it also protects us against cancerous changes. Our cells, every single day, some of them do change into cancerous cells, but our immune system has the ability to identify them and destroy them. In HIV or in AIDS patients, they lose that ability to respond to pathogens and respond to any cells that have become cancerous. Mode of transmission, those would be, I don't want to say sexual contact because it needs to be unprotected sexual contact, contaminated needles, birth or milk from an infected mom, so from mom to baby, or it could be receiving infected blood or tissue from a donor. So one of the tests that if you go in and give blood, or if you're an organ donor, whatever we donate is going to be tested for HIV. Okay, and that takes us to the lifespan changes that happen to our immune system. Because of the thymus gland that shrinks as we age, our immune system tends to decline in function, and that puts us at a higher risk of infections and cancers as we age. Okay, the response of antibodies to antigens becomes a lot slower. Two kinds of antigens actually increase as we age, and those are IgGs and IgAs, while two decrease, and those are IgMs and IgEs. So remember we said that the different kinds of immunoglobulins are gamed, G-A-M-E-D. The two first ones, the G and the A, those increase, while the M and the E decrease. And that, because of the decline in the immune system as a whole, sometimes the elderly are not candidate for certain medical treatments because it will even further suppress their immune system, such as different kinds of chemotherapy. And that concludes this chapter.